What is this thing? How do you use it? Should you use it? And more coming up on today's video. Today we're looking at a very common treatment for elbow tendonitis, also known as golfer or tennis elbow, called a counterforce strap. They're sold under lots of different names and different styles, but they all essentially work the same. What are they and should you be using them? To answer that question, let's look first at what causes this kind of problem. Tennis and golfer's elbow are basically conditions of overuse or repetitive use coupled with delayed or improper healing. That's the root cause of this problem. Whenever, as a physical therapist, I look at whether to use a brace or some kind of support, I really try to understand, is that brace or support going to address the root cause of the problem? Here's an example. If someone sprains their ankle, an ankle brace is going to directly treat the instability at the ankle. Now, in the elbow, when we have this problem caused by overuse or repetitive use and improper or delayed healing, these little straps do not directly treat those two problems. I had to dig a little bit in my clinic to find these. They weren't right at the top of my cabinet because I haven't issued one of these in probably years. Now, there is a time when I would indicate one of these. I'm going to get to that a little bit later in the video. But let me give you an example of how these things work. So this is my little Martin travel guitar. This thing is awesome. And if you are a string player or a guitar player, then you probably know what this is. This is called a capo. And basically what it does is we put it across the strings and it shortens the length of the strings. And as a guitar player, it basically allows me to play chords, open chords that are easier to play, but in different keys. So I'm going to throw this thing on there and it compresses right across the strings. And now I can play all of my open chords. This little counterforce strap basically does the same thing on the forearm, and I'm going to show you how it works. What we do is we take this, and if you have a tennis elbow with pain in the back of this, we're going to thread this strap through, right like that. And then this part is basically going to go right over or just past, moving towards my wrist, the site of pain. I'm going to put some pressure on that. Okay, and there we go. So all of a sudden, I have essentially a capo for my forearm. So why is this useful? Because the muscle that pulls through the tendon, a lot of the tendon pain and problems happens right where the tendon and the bone connect. So by putting this thing on, I'm shortening the tendon just like I shorten the strings on my guitar. So all of a sudden, whatever pull is happening from my hand and wrist is not happening at the painful part where the tendon and the bone meet, but a little bit further because I've created this artificial tendon-bone connection. Now, the problem with this is that it actually works for relieving symptoms temporarily. And why is that a problem? Well, it hasn't solved the underlying two issues. It hasn't solved the overuse or repetitive use directly. Just using this doesn't mean that I'm going to stop doing whatever caused the problem. And it also doesn't address the delayed healing. And what I've seen is as folks use this, they might be developing another problem now at the point of attachment for this thing. And clinically speaking, I don't find that super helpful. It makes people more comfortable and they continue to do the same thing that got them in trouble in the first place. And that's really not great. What's a better alternative? Treat the cause of the problem, the repetitive or overuse, and the tissue healing. And there are lots and lots of ways to do that. If you're new to the channel, I have a playlist put together for you on this topic and a few other videos that you can link to that include diagnosing this, treating, and some key things to look out for if you have this as a chronic problem. So one of the things that I want to show you that I do recommend is the use of something like this. This is a wrist brace And this is because what happens at the wrist directly impacts the kind of repetitive or overuse that affects this elbow tendon problem. So wearing something like a wrist brace when you are doing the activities that might have gotten you into trouble is a very, very good idea. I always recommend a wrist brace for my folks with this chronic problem. And I recommend that they wear it when they're sleeping, when they are driving, chopping vegetables, using the computer, and doing sports, anything that they might have thought would contribute to this problem in the first place. Use this wrist brace. These are pretty simple to apply. Okay, so there you go. So this is going to limit the use of my wrist, and movements of your wrist are one of the contributing factors here. The other factor is over gripping. This wrist brace is not going to prevent you from over gripping. So if your cause of this problem is over gripping, the wrist brace is not necessarily going to be the best solution. Activity modification is really going to be better. But this is actually quite comfortable and very stable. This brand, BioSkin, I hope you can see that, it's actually pretty good. And this is called the DP2 Cock-Up Wrist Splint. Go right there. So is there a time that I would recommend that you use one of these? Well, there actually is, and it's early in the stages of this. If you are having extreme pain and you're completely unable to use your hand and wrist, I would throw one of these on for short periods of time, maybe a half hour at the most at a time, just to get through doing the things that you need to do. Another case would be if this is more chronic and long-term and you really have to do certain things that are irritating to your elbow tendons, like chopping vegetables or folding laundry, or just doing daily tasks like that that you must do, that you can't get away from doing. I could see having one of these handy just to help you manage your symptoms while you're doing those, but taking it off immediately after you're done. This is not something that I would recommend a person wear for 8 hours of office work, for example. Now let's talk a little bit about sports, because it's very common to see these in our racket sports, in golf, all of these kinds of sports where you're using grip and or rotations of the wrist and hand that have caused this problem. A lot of folks will throw these straps on and just do their sport. I would say I'm more neutral on that if you are also developing the strength and working on the recovery techniques or methods that you need to do in order to heal the problem. So if you're rehabbing it basically, and you want to throw this on to play a game of tennis and you're not going crazy and playing hours and hours, I think as a transitional tool, this could have a role. So folks, there you have it. Let's review again how to put this on if you do decide that you need one. And this is reversible. It works on either forearm, and it works on the outside as well as the inside. And we're basically going to center this little inflatable pillow right over the spot where you have pain. So let's imagine this is a spot of pain. I'm going to put this right over that and snug it down. Okay, let's say this was more of a golfer's elbow problem and I have side of pain kind of right on the inside there. I'm just going to get that right over and cinch it down, and there we have it for golfer's elbow. This particular product, their claim to fame is they use this little inflatable bladder as the source of pressure, which should distribute it a little bit more. I've tried others and I think they can be equally comfortable. And if you're just wearing it as I'm recommending for short amounts of time, that's probably fine. Whatever you can find in your drugstore should work. This particular one is made by this company, Aircast, and it's called a pneumatic armband. Well folks, there you go. A little bit of an overview of counterforce straps or armbands for elbow tendonitis. What's your experience with these armbands? Have you had success with them? Leave me a comment in the comment section below. And if you have another brace that you really, really love, let me know that as well. Thanks for watching. See you next time.